Premier, thanks for talking to 7:30. The attack today on the Prime Minister and on the questioning of AstraZeneca was pretty extraordinary. It seemed like there was quite a bit of pent-up frustration in it, but can you tell me why you decided to go in so hard, and what do you say to the Canberra retort that you were just trying to distract people from failures in the Queensland system that let the virus out?
Well, thanks, Laura. So it was quite extraordinary to hear the Prime Minister say the other night after National Cabinet that a decision had been made to give AstraZeneca to people under 40. There was no such decision taken at National Cabinet. We merely noted that the Commonwealth will be giving an indemnity to GPs. So I was very concerned, and I think likewise you've seen today, other colleagues of mine were also concerned that this was not the advice that was given by ATAGI, it's not the advice given by our Chief Health Officer, and it's not the advice that the AMA has given. And at the end of the day, I've got over 1 million young people aged between 20 and 40 in my state, and I don't want them put at risk.
Well, other states, as you say, have also expressed their frustrations or anger about this, but I was just wondering whether you could talk us through how this actually came up at National Cabinet the other night.
Well, what I can say is that it didn't come up, pure and simple. So my question today was very clear. If it didn't come up at National Cabinet, what did the Federal Cabinet decide? So my question there is, did the Prime Minister take it to Federal Cabinet? Now, we've always listened to the health advice in this state, and it has stood us in really good stead. I mean, I'm very proud of the way Queenslanders have responded to this pandemic, but I don't want people giving out incorrect advice that could put people's lives in danger. And that's exactly what Dr Young said today, that we could see the situation where a young person or young people under the age of 40 lose their lives from a vaccine when they would be basically not getting very ill or dying from COVID if they were susceptible to that. So it's very simple logic that there was no clear health advice presented to National Cabinet. It was not discussed at all at National Cabinet. And I think we're very disappointed that this happened at this stage, because National Cabinet has worked well in the past.
Well, as you say, you don't want to add to confusion and hesitancy, but wasn't the very strength of your language today likely to just do that? I mean, your Chief Health Officer says, I don't want an 18-year-old in Queensland dying from a clotting illness who, if they got COVID, probably wouldn't die.
Well, Laura, let's go back to the original. AstraZeneca was manufactured by Oxford AstraZeneca in the United Kingdom, and now they're not offering AstraZeneca to their under 40s. In the UK, they've had some 49 deaths, is my understanding. So this is the data I'm very concerned about, and I think all Australians should be concerned about it. And the advice has not changed about under 60s being given AstraZeneca. But
the advice, the ATAGI advice, does leave open the prospect of people getting AstraZeneca under 60 on the advice of their GPs. And technically that's what the Prime Minister is saying, isn't it?
Well, people can go and have conversations with their GPs, and I encourage that. But, you know, I think the Commonwealth was looking at setting up mass vaccination hubs to administer AstraZeneca to the under 40s. I mean, this is extraordinary. That's not having a conversation with your GP. And why are they not allowing people under the age of 40 in the United Kingdom to get AstraZeneca? Why would we do that here? It just does not make logical sense.
Let's look at the failures in your own system. You've had one person infected because domestic and international travellers were mixed in the same hotel facility, and one because a staff member working outside a COVID ward wasn't vaccinated. What's Queensland doing about overhauling its own hotel quarantine system in light of this? And why was the hospital worker unvaccinated?
Well, let's start from the beginning here about quarantine, shall we? Well, quarantine is a federal responsibility. And when National Cabinet met and we talked about doing, national quarantine, we said we'd help out for a couple of months. This pandemic's been going on for nearly 18 months now, and our resources are stretched to the limit. What we do know is that the virus we're getting now, the predominant virus strain going across the world, is the highly contagious Delta strain. Our hotels were not meant to be dealing with highly infectious strains of COVID in the first place. And secondly, even our hospitals are not going to be able to contain this highly infectious Delta strain. Yes, the clerical worker the casual worker sitting outside the COVID ward wasn't vaccinated, but our hotels are not a defence mechanism for this virus.
But how did it happen that right at the COVID ward, you had somebody who was unvaccinated?
She was outside the COVID ward, and let me say, the person who brought the Delta virus in had left Australia, left Queensland numerous times and was unvaccinated. If the person had left Australia in the first place, vaccinated, this may never have happened.
But you still have to answer this question. Somebody's got to be responsible for the fact that on the other side of the equation you had unvaccinated people, so you had a breakdown in the guard against this spreading.
We're trying to vaccinate as many people as possible. Like I said, over 66% of our health workforce is vaccinated. You would have seen the situation in New South Wales today, where I understand a student nurse was unvaccinated going into hospitals. We are trying to vaccinate as many people as quickly as possible. Compare that to the federal government, where they have only vaccinated 18% of their aged care workforce, and we are offering to help vaccinate that aged care workforce. So this is a combined effort. We need to get as many people vaccinated as possible, and if we had more Pfizer and more Moderna and more supplies, we could vaccinate more of the Australian population now.
For the moment, we're stuck with hotels in the absence of more special purpose facilities. What are you doing to change the system? Are you trying to separate out domestic and international travellers, for example?
Yes, that decision was made at National Cabinet. Of course we're doing that, but we're in a pressure cooker situation at the moment. Our resources are stretched. Queensland has dealt with some 55,000 international arrivals since this pandemic came. We have, on average, around 180 to 200 international people coming per day. The first thing I'd like to see the Morrison government do is reduce the caps. I've always strongly advocated for regional quarantine. I believe regional quarantine is the answer. It would alleviate the pressure on the states, on the East Coast, on the major capital cities, and you would not see these lockdown situations that are happening now in Sydney for 2 weeks, in Brisbane for three days, and you've seen it happening in other places, Victoria. Also, most of the country at the moment is in some form of lockdown except Victoria.
Well, how much of a cut in those caps would you like to see, and will you be putting it National Cabinet on Friday? And are you also looking for changes in criteria for people who are coming into Australia?
Absolutely. I would like to see a massive reduction. We need to do that now because we need to contain this Delta strain.
How much?
At least 50%, 75%. Let's reduce that right down. Also, too, I've said today, why don't we have people who are leaving Australia and coming into Australia who are vaccinated? I am frustrated that we are having to deal with so many international arrivals that have the Delta strain now. This is putting the entire population at risk. The federal government is responsible for quarantine and the supply of the vaccine, and they have let the population of Australia down. We have had a magical moment here, a magical moment in time we're never going to get back, where we could have had the entire population vaccinated before the virus has arrived in this way. And now I'm very concerned that we may have left it too late.
Premier, thanks so much for your time tonight.
Thanks, Laura. My pleasure.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.